Hello and welcome. This is the Qualitative Report webinar. My name is Miranda Berger, and the purpose of today's webinar is to walk you through the Qualitative Report Excel file template. Historically, qualitative reporting has been completed on OCH's online reporting platform, Orca. All of the resources have now been moved from Orca to the OCH website, and reporting has been moved to Excel. Orca will remain available to partners through December 31st if there are any materials that you would like to collect off of the website before it is closed. So starting this round of reporting and moving forward, all of our reporting, OCH reporting, will be completed via Excel files, which are mailed to you individually. You'll receive your organization's individualized reporting template. If you are an organization that has both a hospital and a primary care change plan, you will receive two separate files, one for each change plan. If you are an organization that has an integrated change plan, meaning both a primary care and behavioral health, then you will receive one file with your comprehensive integrated change plan. So the purpose of today is to just walk you through and familiarize you with this new Excel file template and answer any frequently asked questions that may come up. If after viewing this webinar and the instructions, if you still have questions, please feel free to contact me at miranda@olympichorg or by my cell phone at 360-633-9579. The first tab on this Excel file is the Instructions tab. This will walk you through the instructions for each subsequent tab. To complete your qualitative report, please complete all of the blue cells on each corresponding tab. Only tabs that apply to your organization's specific change plan will be visible to you. This round of reporting will be due no later than January 6th, 2020. This reporting period is for the July through December 2019 reporting period. So the first tab where you'll actually complete your reporting is called Change Status and Change Plan, and that's this tab here down in red. And you'll see that this will show your organization's change plan. So here in column C is the domain of the change plan. Column E shows the focus area. Column G shows the outcome. You will see if you selected a particular outcome by start and target dates being listed in the columns next to it. Remember that all bolded outcomes are required for your change plan. You do have the opportunity to select which voluntary outcomes, which are non-bold, you would like to participate in for the year of 2020. So the first step on this tab is to update your change status. This is similar to previous reporting you have done in Orca. Here in columns T and U, you'll see your previously reported change status. And then what you will update is here in column V, indicated in blue. So you can update this by clicking on the drop-down menu in the cell, and you can see that there are selections ranging from not started all the way through scaling and sustaining. So you'll update the change status that is most appropriate. If you have questions about what each of these change statuses mean, you can refer back to the Instructions tab here, where we have given some brief definitions of what each change status means. You also should review, while you're going through and updating each of your change statuses, you have the opportunity to review your change plan for 2020. So column BB is where you will make any changes if you would like to change the scope of your work for your 2020 change plan or make any change plan amendments. So this column has been pre-populated with your data from the previous year. An X indicates that you have selected a particular outcome, tactic, or sub-tactic. So for example, you can see here that this change plan has selected the following sub-tactics underneath this first tactic. So if you decide you would like to make any changes, you can do so in column BB. It is unlocked, and you could simply, if you decided that you don't want to do something anymore, remove that X, or scrolling down, if something previously did not have an X and you would like to add one, you can do so by just selecting X from the drop-down menu, indicating you would like to add that to your 2020 scope of work. What is indicated here in column BB is what will be included as your scope of work in your fully executed 2020 contract amendment. Moving on to the other reporting tabs. If you are a hospital, primary care, or community-based organization, you will find a Pay for Reporting tab in your reporting template. Pay for Reporting metrics are a required reporting element to the healthcare authority. The reporting on these metrics are one of the ways that OCH earns funds, which are then passed along to you, our partners. All of the responses to these metrics are combined before OCH submits them to the healthcare authority. So no single organization's responses are identifiable in the report that OCH sends up to the healthcare authority. Only the metrics that apply to your organization type will be included here. If you previously reported this data to OCH, that has been pre-populated here in columns F and G in white. And we have included that in this reporting period indicated in blue, where we would like you to update your responses if necessary. When filling out the Pay for Reporting metrics, you should include answers for each of your applicable sites. So we have 2 example sites here. If you have added a new site, then you can do so here at the end. Please add as many columns as many sites as applicable for your change plan type. Indicate your responses to each of the questions using yes or no. Please do not leave any cells blank in the Pay for Reporting metrics. If you are a behavioral health partner or have an integrated change plan, you will see a MEHAF tab. The MEHAF assessment is the other Pay for Reporting requirement that OCH must submit to the healthcare authority to earn funds that are then passed along to partners. OCH also combines all responses to the MEHAF before submitting to the healthcare authority, so no single organization's responses are identifiable in the report that is sent to the healthcare authority. The MEHAF assessment is intended to assess an organization's current status of integration for patient and family-centered primary care and behavioral health and mental health care. You may have completed the MEHAF assessment before, or this may be your first time. Future MEHAF assessments will show the changes your site is making over time. To complete this tab, it typically takes 30 to 45 minutes. So we request that you fill out the MEHAF assessment for your behavioral health program only. You will rate your patient care teams on the extent to which they currently do each activity in your behavioral health program. The patient care team will include staff members who work together to manage care for patients. This may include healthcare providers, behavioral health specialists, specialty care providers, case managers, or health educators and front office staff. We'll ask you to indicate here on line 4 with a yes or a no whether or not you discussed these ratings with other members of your team. And then moving down, on each line, you'll be asked to rate your care team for your behavioral health program. So say I rate question 1 here as a 4, and it will indicate my response here in column P. Please complete all of the questions included in the assessment. Moving on to the last tab, all partner types will have a narrative tab in their reporting template. The purpose of the narrative questions are to inform OCH's biannual report to the Healthcare Authority and to inform OCH staff about the progress of your selected change plan activities. The narrative questions will look different from questions you have previously reported on. Please submit your answers to each of the questions in the blue text box. Different partner types will receive different questions, so your reporting questions may look different in each file if you're receiving multiple reporting files. Please provide as much information as necessary to fully answer each question. Moving back to the Instructions tab, you will find a section of frequently asked questions. If you still have questions about completing this report after viewing this webinar and the Instructions tabs, please contact me, Miranda Berger, and I will be happy to assist you. Remember, this report is due January 6th. You'll be asked to submit each tab fully completed, including making any change plan amendments that you would like that will be included as your 2020 scope of work in your 2020 contract amendment. Thank you so much for your time and attention. We look forward to hearing from you.